addressing them in our community. Now, this is a very relevant conversation because you know that it's a very complex and deeply rooted challenge. Now, there have been historical injustices, systematic disparities, and unequal access to healthcare. This, of course, has fostered a sense of systematic skepticism and apprehension. So, as we explore this topic tonight, we aim to understand the multifaceted reasons behind mistrust and, of course, work together towards building a foundation of trust for a healthier future, not just in the city of Miami Gardens and across the state of Florida, but across the nation. So I really invite you to join this conversation. We have a very interactive discussion planned for you tonight. Our guests will bring a wealth of experience and expertise to this conversation, shedding light on their efforts to bridge gaps and foster understanding. Now, before we dive into this discussion, let me introduce you to our esteemed guests. First, we have Tehsin. She is a physician and community advocate with a wealth of experience in South Florida. Tehsin is not only the president of the Muslim Women's Organization, but she's also a board member of SARA of South Florida, NAR Center, and Cosmos. She believes in promoting understanding and building bridges within the community. Welcome, Tehsin.
Hello.
All right, fantastic. And so next we will have Husna Oleed. She is a dedicated adult nurse practitioner at UHI Community Care Clinic. With a background in critical care, she has passionately provides primary care to uninsured patients, focusing on preventive medicine. Her impactful doctoral project addressed cervical cancer screening disparities of South Asian females, emphasizing cultural sensitivity, a committed mentor and community advocate. Husna resides in Broward County, actively engaging in local community activities. Hi, Husna, how are you?
Hi, I'm good. How are you?
I am well. And joining the conversation is Dr. Pyke. Now, he is an experienced physician who recently joined Jackson Health System with over a decade of experience as a chief medical officer at Medicus Healthcare Solutions. Dr. Pyke has been a driving force in healthcare consulting, guiding leadership at numerous healthcare organizations. Welcome, Dr. Pyke.
Thank you.
All right, so now before we dive into this community power conversation, I want to give you a chance, each of you, to just kind of sum up your professional background, just to give us a highlight of what I may have missed in your very abbreviated bio. Why don't we start with you, Dr. Pyke?
Sure. So I am in the service business. That's basically it. That's as best as I can sum it up. My dad was a waiter, and I always kid with him that I'm in the service business. So I'm here to serve people in a different way than he did, and that's it. So I've done that for 27 years now of practice, and now serving the Miami-Dade County, and so I'm very proud of that.
Oh, that is such a powerful way to describe what you do, because you're absolutely right. As a physician and as a healthcare administrator, that's exactly what you do. Thank you for that, Dr. Pyke. All right, Husna. Husna, and please pronounce your name properly for me.
It's Husna.
Husna, yes.
Yeah. So I'm Husna Oleed. I'm an adult nurse practitioner working at UHI Community Clinic in Miami Gardens. And I've been a nurse practitioner over 10 years. And before that, I did work as a registered nurse at Broward Health in a critical care step-down unit. I did my bachelor's from India, and I went to FIU to get my master's and my doctoral degree, DNP. And I do have my passion towards primary care, and I believe in preventive medicine than going through the steps and, go to complications. Especially this is important in our South Florida community, because we have like a mix of everybody, minorities, underinsured, uninsured, underprivileged. So, we have to talk more about prevention and promotion of health, compared to, fixing the problem once there is also already a problem. So, I do, I'm a proud nurse practitioner, and my personal values reflect with the UHI's mission and vision, and I do like what I do every day.
Oh, that's
Thank you.
fantastic. That's fantastic. Passion and commitment to service. That you definitely have something in common with Dr. Pyke there. All right, Tehsin.
Hi, I'm Tehsin Siddiqui. I will describe myself as a, you said community leader, but I would say advocate of underprivileged, as well as a leader in service. That's where I kind of come from. My personal values motivates me to be in service and giving back to the community. I graduated from Nova, had the chance to go to med school, but I declined, and then took a year off and went to PA school the following year. At that time, had gotten involved with the community work. The first organization I did get involved with was a Sahara of South Florida, which was the Bridging the Gap, connecting underprivileged women of color and South Asian communities to mainstream services in domestic violence, the women that are going through with domestic violence. It's a topic that's not so much common and talked about in our communities. That was my first exposure in community service. Down the road, I am now serving as the president of the Noor Center, which is a domestic violence shelter, providing culturally sensitive support to South Asian and women in South Florida who are going through domestic violence. Other than that, I have a passion of empowering and uplifting women all over, if they're not even going through domestic violence. I think every woman is unique, and they have different abilities. Sometimes we are, I think, women overall, no hate towards men. So we are so busy giving. Sometimes we forget to fill that half empty cup. So I'm also a president and co-founder of MWO, Muslim Women Organization, where we bring programming and also services to just community women, so they along with their families can get involved with service, empower themselves, and give back to have opportunities to give back to the community as well. And my third passion is building bridges within Muslim community and community at large. And for that, I serve as the board member and president for Cosmos, Coalition of South Florida Muslim Organizations, where our goal is to basically show a human face of our faith, and as well as bringing people together and really take away the biases and give an open forum to people to learn each other and exchange ideas. So that's in a nutshell what I do.
Thank you for laying that foundation. So the thing that we have in common, all of us here, is the commitment to service and bridging the gap. Tonight we're talking about medical mistrust. And so before we begin the conversation, let's define what it looks like. In your experience, what kind of mistrust have you noticed that patients may have? Dr. Pyke, let's start with you.
So to start, patients do have a reason for mistrusting the medical community. We have ample evidence even before the era of social media and things going viral. Which is a commonplace term for younger folks, but folks who are older, I don't really understand what that fully means, but it sounds like it's actually spreading quickly. But essentially, nowadays, when something bad happens, it spreads very quickly. Even years ago, when I started in medicine, one of the top reasons patients die inside of the walls of the hospital was actually a medical error. And so patients are family members, patients are people, they have friends, they have loved ones who've gone through that. So they have a direct connection with someone who had a untoward circumstance inside the walls of a hospital or a clinic or a doctor's office. That can be taken in the form of actually a medicine that was not the right medicine for the patient, a medical error, medication error. It can take the form of biases where a patient is marginalized in some way, a woman of color, a male, whatever that person is, who try to engage with the healthcare community and was actually not treated in a proper way. So there's a lot of reasons why patients are actually not trusting the medical community. We have, going all the way back decades ago, to in the patients of color, having in our lifetimes, in our parents' lifetimes, we have specific errors that were made, and the Tuskegee experiment is one that comes up all the time. That's legitimate. That's legitimate, and it's legitimate in the minds of many patients and people who are actually engaging with healthcare. And so that's the first thing I think we need to actually do, is to accept the fact that people have reasons to actually not trust the healthcare system. But that stated, I think that the engagement has to be done with purpose, and the engagement that people have with the healthcare system should be done in a way where they have information, and education is information. So that education, you know, folks who are more educated about themselves and their health usually are going to be less at risk for things like these happening. However, you go from very famous people like Serena Williams, when she interacted with the healthcare system as a woman of color and having her child, to my own sister-in-law, who was an OBGYN, as she was having her own child in the hospital where she was working, and having a very negative interaction on many levels. And so there are unconscious biases, there are actual conscious biases, there are so many things layered in, not only for general people of color, but particularly, honestly, women of color. And so I think that they have reason to mistrust. And during this conversation, I'll be happy to share things that we're doing to bridge the gap between what patients perceive us to be and what we aspire to be, honestly, because we're not there yet.
Yeah, it's a work in progress for sure. And thank you for just laying that foundation and just acknowledging that there's a reason for mistrust. Need to understand, what have you heard from some of the women that you serve in the Muslim community, or women that you serve who have experienced domestic abuse? Have they spoken to you about having some medical mistrust challenges? You're muted.
Sorry about that. I also served as the intern. That was my first job. I was in direct contact with the clients that would call our hotline at Sahara of South Florida. And I have spoken to them on length. Many times, I think providers, we in Florida, we are required to go through the 2 hours of domestic violence training and everything like that. But I think there's so much pressure on providers, constraints of time, being able to actively listen, to slow down, and sometimes personal biases as well, where women, it's studies show that the domestic abuse women or women who need help go to the providers many times, but the providers don't have that extra time, and they tend to ignore it. They go with non-specific complaints. They won't come in, they won't show, the bruise that is like hidden by their shirt or something like that, but they will go for non-specific complaints just for the provider or somebody else to notice, because many times these women are isolated, and that is the power and control wheel that, and the cycle of violence that they are kept in. But many times that's the only avenue that they have. So yes, they develop, like Dr. P said, they develop that mistrust, and mistrust is real. But there are, I feel, the way our system is built and how the providers are so pushed and pushed for time, many times those things are overlooked that they should be. A common question a provider usually asks: if you feel safe in your relationship. I haven't gone. I think I'm a mother of 3. The first time I went to the provider when I was pregnant, that was the only time I was asked if I feel safe in a relationship. Just because other than that, all my encounters that I have had with physicians, and I had plenty, because at least I gave birth 3 times. So there was that encounters that happened, but that question was not asked, and that's me right there. So I feel a lot of times the obvious is just not done.
Wow. So Husna, I'm so sorry. Could you please share what it is that you guys do at UHI? Earlier in your introduction, you said that their core values align well with yours. A bit about what you guys do and how you help to rebuild trust in the community.
Okay, so first of all, both of them already mentioned about different incidents. So what we serve in our clinic, we serve the most underprivileged, uninsured population and minorities of our area, especially we're located in Miami Gardens. So talking about trust, first we have to understand why it's important, to build trust. And literature shows that trust in a provider, not only in a provider, an organization also affect a patient's healthcare decision and outcome. So establishing trust is an important part, then we can talk about equity, equal care, access to care and everything. But if there's no, trust established, it's very hard to achieve these goals. And, there is many reasons for different communities, not to have trust. It could be, we cannot put all this reason in one umbrella, because for example, some of the reasons from the history, including racial discrimination, language barrier, low income status, low educational status, lack of insurance, and cultural barriers. For example, from the history, exploitations that happened in the past, that keeps minorities away from provider. And, according to literature, Hispanics and African American population shows more mistrust compared to their white population based on the studies. And this was actually reflected, when the COVID vaccine was introduced.
Yeah.
And, that's a whole area of a discussion. So I'm not really talking about that, So, and talking about South Asians, they are more used to seeking care when they're sick. And a lot of majority of this population have language issue on top of all these things that we addressed. And a lot of time, people who doesn't speak English, unfortunately in the community, a lot of time this bias is there, oh, maybe their intellectual level is a little bit lower than compared to who speak English and all. So all these things, there's many reasons. So, and it's very deeply rooted. And there's not many studies are also there, So as we all know, our community, South Florida and Miami and all, we have people of different backgrounds, different ethnicities, race, languages, religion, and sexual orientation. And, when we talk about ways to address this medical mistrust, it's not really a simple topic, because, the root causes are not the same for every single person. Okay. So as a clinic that we see the underprivileged and only uninsured in the community, we represent the minorities within the minorities. So that's our patients. And majority of our patients are Hispanics, African Americans, South Asians, and a lot of other ethnicities. We have people from all over the world. And before, talking about the ways that we address this issue, I just want to give like a quick background about UHI Clinic. So UHI Clinic has been providing free healthcare to the uninsured population in South Florida since 2018, and we are located in Miami Gardens. So our mission is to provide free healthcare service to the underserved population of South Florida, regardless of their ethnicity, national origin, sexual orientation, religious and political affiliation. That itself clearly state which actually I think bring population to us, they can see that that's a trustable organization. And we do offer high quality care, just like any other private clinic and insured people. And we do take every step to bring equality, as we stated in our mission. So if you look at the history of UHI, this was the clinic was founded by community members. They all belong to the community of they are immigrants. They are belong to the minority community. So, but they were more privileged, compared to those populations. So they had this vision and they understood the cultural barrier and everything when the proposal was made. So the plan was to create this environment where the care is accessible and high quality care, and also where a trusty relationship also can be made, between the patient, provider, organization, and the community. So we do, as a clinic and as provider especially, we do take some intentional steps, extra steps to narrow the gap and to build the relationship and the trust. So one most important thing is active listening, so that's one essential factor. And many of them bring their family members for the visits. So when we talk about active listening, and that's when the trust is built. And one of the first barrier is language. So even if don't speak the language, they deserve the right to the same quality care that we wish for our parents, partners, kids, and all. Since beginning of UHI, we always made sure that we have translation available, especially for Spanish, as Hispanics are the predominant minority in the area. So our staff, provider, volunteers, and everybody involved actually represent our general population in the community. So we understand, culturally sensitive way, and it improves the care. Our staff is multilingual, and some of the languages that we have, in the clinic, spoken by our team are English, Spanish, French, Hindi, Urdu, Bengali, Malayalam, Tamil, and Creole. And another thing that we do is taking time with the patient. And listening takes time. And a lot of time in typical clinic, that time, they lack the time. And many of my patients or have not seen a provider for many years. Maybe this is the first time they see a provider after 10 years, 15 years, and I do see this every single day. And by the time they see the provider in their 50s or 60s, they already have multiple issues. So we don't typically put this 15 minutes so that you come and talk about a little bit of things and you go in when you come back. So our appointments, taking time, we understand that taking time is important. So we make our appointment, with these things in mind, and we give enough time between the patients, considering the time for translation or not. Translation and everything it takes to cover the patient as a holistic way, and I am up to date with the medicine, and all the other provider. But, when they come to you, we have to hold their hand to walk through the journey when they are so behind us, So we have to listen with empathy and validate their points during the visit to bring the best out of the visit, And if there's no trust is built during the first visit, there's no way that they're going to come back, to the provider.
Sure.
Yeah, and we also, because our patients are working class people, And a lot of time they don't have a job that, they get paid for taking time off and things like that, so when they have to pick between the work and feeding their kid versus healthcare for them, they skip their healthcare needs and screening and all those things. So what we do in our clinic, we do have extended hours a few times per month. We stay open until 7 o'clock, so they don't have to worry about missing work and salary for the day. And we also offer telemedicine, so they can do so. We take time, I think it's important, and I want to specifically mention that we take pride in that. We don't just see them as like a case or number of patients. We take time, and the approach that we take in the clinic, we see them holistically, and we address their mental health issues, food insecurity, if they have a place to sleep. And so once we find out about everything, this is a part of our intake process, and all these things are done in languages which they are comfortable with. And not only that, we address that, so automatically when they understand there is someone that they can, someone addressing this issue, and there's a trust. You cannot just ask someone to trust us just like that, so it
Yeah,
just
it
comes
takes
to
conversation. Yeah,
yeah.
it takes conversation and relationship. You actually said quite a few things that I want to explore. Dr. Pyke, we know that, particularly with the culture of the way medicine moves now in the business of medicine, it is often encouraged by payers for physicians to spend a lot of time doing exactly what was just described. How, as a administrator, do you navigate and bridge and balance out the need for what the payers, which in cases of those who are insured, the insurance companies, and then this idea about active listening and creating enough time to fully get to know the patient? How do you balance that?
So it's a challenge. We have competing entities and stakeholders in healthcare, and now you have an emerging, actually not even emerging anymore, but it's here, is artificial intelligence and machine learning. And a lot of that, actually, we are still in the stage of hoping that it helps us to be better clinicians. But I'll give you an example of one thing that we hoped and it didn't work out that way: electronic health record. So electronic health record, when it came into being 20 years ago or so, we hoped that it was going to actually work, that the physicians and the other clinicians would be able to spend more time with their patients as opposed to documenting what they did. And that did not work out the way we actually hoped. And today, as we actually enter a new stage of healthcare where we have machine learning helping some providers, it's not widespread, but it's definitely there, where artificial intelligence and machine learning is actually there in the background working alongside. That's the next hope for providers to actually start doing the things that they should be doing rather than actually documenting. Right now, we spend a very small fraction of our time in front of the patient and with the patient, and a much greater amount of time. And we're talking physicians, nurses, nurse practitioners alike spend so much more time actually engaged with documentation of what they did rather than actually doing the thing. And so one of the things we're investigating, at least in Jackson, alongside other healthcare organizations, is looking at ways for us to keep the providers more engaged with the patient and not just sitting there documenting what they are supposed to do or what they did, because it does take away from that action. I think that in many ways, the patient is so much smarter, so much more informed today, that when they show up to interact with healthcare, they have more questions and they have more concerns that are specific. And it's on us to actually pay attention to that and inform them, because the best thing we can do in serving our patients is educating them. In a healthcare system like Jackson that serves such a large population in Miami-Dade, and we have, 14 or so thousand employees doing this. Every day, what we're striving to do, and we're engaged right now at Jackson with an endeavor to literally try to transform the way we actually engage with patients to get the providers to be working at the very top of their abilities, and everyone downstream working at the highest level of their abilities. It is a journey, and I say to my physicians who work in our organization, nurses, that what we're engaged in is a journey to better. And so while we do not have an answer today, any kind of answer we give today is going to be something that's more aspirational than actual. And so we're trying to engage with our providers to get them to be at the bedside more purposefully, be engaged with their patients in a more education fashion, because what we're trying to avoid is the downstream bad effects that happens to patients. And us as educators is going to be the thing that actually reaps the biggest benefits.
And are you finding that this new push is something that physicians are looking forward to perhaps creating the shift?
Physicians are skeptical. Remember, physicians are like anybody else in society. Anything new that is actually brought to them, they're skeptical about it. As a physician myself, I'm skeptical. One of the things about this emerging artificial intelligence and how that will actually engage with physicians. I'll give you an example of what aspirationally I see the next iteration of healthcare in the US. So right now, you go to see a physician in an office, and in large part, that provider has their back probably turned to you, facing a computer screen, and they're talking to you, and they're typing as they're talking. The reason they're doing that is not because they're bad people, right? But they have competing interests. They have to finish this documentation to get paid, and they have to finish this documentation because whoever their employer is forcing them to finish the documentation. And so there's a thing right now in healthcare where we have a lot of bedtime documentation. So the physicians or providers, they do the work, they don't have the time to document during the daytime. So they spend the nighttime hours when they should be with their 3 kids or other kids, as Tehsin or someone, they're spending this time documenting. And so that's taking away quality time from their own families. And then that provider comes back to work the next day, somewhat tired, somewhat disengaged, and that cycle continues. So picture the next iteration of this. A provider walks into a room, the badge swipes that provider entered the room, they engage and speak to the patient, and in the background, you have some listening device, albeit artificial intelligence, listening, and they parse the conversation as I engage with that patient in a very meaningful document. When the provider leaves the room, that provider can just go to the next room because that document is now created. Because as I said, 90% almost of the time spent in healthcare is spent documenting, not actually doing what the patient needs to get done. And a lot of things that we need to do, especially in the primary care sphere, is educating our patients how to avoid the downstream bad things. Because the information is there, but the actionable or the information for people in our communities, they don't understand. It's like having a plumber come to my house and try to explain to me what he or she is doing. I don't have the aptitude to understand that. So that person has to break it down into ways that I can understand. I have to do the same thing for my patients. But to Husna's point, I'm sorry, Mr. Pronounce your name, time is required for quality. You cannot have quality interactions with patients and therefore trying to allay that trust issues that they have by not having the time to do it. And I believe that the next iteration of healthcare with more, face-to-face contact with your patient is going to help with that. But that's for most of our communities is maybe another almost 5 to 10 years away from here. So, I'll pause there just to actually allow, Tehsin and others to chime in on that. But I think there's a lot being done, but there's a lot that needs to be done today for the patient who's actually engaged in healthcare today. And I'll stop there so we can actually further the conversation.
Yeah, what are your thoughts on that, Tehsin?
I think that is a very a step in the right direction, and I 100% agree with Dr. P in regards to when the electronic medical records came. They had everything, like from like what the patient doesn't even come for, and you're required to like we as PAs. I was trained 20 some years ago now. I've been working for the last 16 years. So when we were trained, medical the EMRs were just coming in, and there was a focus exam and there was a detailing exam. Detail exam, we did it for new patients, and focus exam was for patients that are only coming for stomach pain, or only like, you know, for a headache or something, and we only did pertinent. But now I know there are a lot of and EMRs, you have like a lot of templates that you can pick, but again, customizing it and then filling it takes a lot of time, and it takes a lot of time away from the patients. And the idea of AI is promising, but again, there's a cost related with it. Even if big institutions like Jackson, Cleveland Clinic, you know, Memorial, if they even input that, I think reimbursements from the insurances is going to be a task uphill. And so all of those, it's going to come there, hopefully, but I think it's going to be a challenge, and it's going to continue being a challenge. And then basically having that translate into building trust. Repetitive encounters are something that if you have a good encounter and then followed by a good encounter, followed by another good encounter, does make it build a positive reputation and so positive rapport with your patient, because that's what really ultimately have them believe in you, follow your advice, come back for their 3-month follow-up. Otherwise, like Husna said, patients, they have to pick. And we are talking about in the sphere of a free clinic where your insurance is not being charged. You are not paying a copay. You're not paying, majority of the time, not paying for a blood work even. You're coming in, it's your time, but it's in between. Am I going to miss work, or am I going to take care of my health? So it's very important, and they want to see the value. Patients wants to see the value. A typical doctor's appointment basically is all day. It's like a 3-hour ordeal, half an hour to go there, wait for 2 hours, and half an hour to drive back. That's and that 2-hour wait, you usually get to talk to the doctor or tell the doctor for 5 minutes, unfortunately. But it is the system that we are in. And hopefully, with a lot of innovations that are happening in healthcare, we will get there. But when we get there, it's a little bit far.
Wow. Yeah. This is such an exciting conversation to talk about what's possible. I know that we have some questions in the chat, so let's go there. Pascal, if you could type your questions in the chat. One question that we have is Horace Ward says, thanks for the very, very informative presentation. And he also wants to know, is Cosmos available for making community educational presentation on faith foundations?
Definitely. We're available. We can connect. I can give my email address, and not sure if I'm supposed to write it here or.
Yeah, go ahead and put your email address.
Yeah, I can put my email address.
And then why don't you also tell us what's Cosmos?
So Cosmos is Coalition of South Florida Muslim Organization. It is a 10-plus-year-old organization. It was founded by the vision of, unfortunately, after the events of 9/11, Muslim community came under a unprecedented time per se in America overall. A lot of people were picked up. A lot of people were indicted without any, due process per se. And a lot of question was how, like, people did not know. As a Muslim community, we are very introverts, I guess. And I think every faith has a right to be introvert, because faith is such a personal thing. So, but more than that, there was the images that were pouring in from overseas, that showed very different attitudes. So the discrimination and Islamophobia in all over in the United States was at most high. So the founders of Cosmos decided that we're going to actively and proactively share the fundamentals of the faith. As many know, that it's a part of the Abrahamic religion. So we believe Moses as a prophet. We believe in Jesus, and we feel that Judaism came first, then the Christianity, and then came Islam. And basically, founder of our religion was Abraham. So our whole idea is that we build upon our similarities, because there are a lot of things that divide us. There are a lot of things that me and Husna don't agree on, right? She likes vegetables and I like salad, but not the cooked vegetables. So, as human beings, diversity is great. It should be celebrated, but we should really, really focus on things that unite us, so we can uplift and really bring a community together with us. And there shouldn't be any place for hate anywhere. So that's in a nutshell what we try to do. We do educational programming. We try to meet with law enforcement and, address those stereotypes and biases. Somebody who looked like me have a scarf on. I have my personal experience. I've been to Publix, and the person at Publix thought that I can't really hear properly because maybe these things block it, or maybe also I don't speak English because
Wow.
I don't look the way a model American should look, right? So they might just like talk loudly, and I have had experience like that. I've been, as a healthcare provider, been told with my scarf that, hey, you're free in this country, you can take this thing off.
Oh,
So,
no, stop
yeah,
it. Somebody said
that was
to
my
you?
yeah, that happened to me. There was my patient who did that, not at UHI clinic, but it was, I won't name the hospital it was in, but that happens. And a lot of time these again, that it's just not the medical field that we need the trust. I think as humans we need to have trust in each other's ability and in a goodness that anyone is bringing to you. So Cosmos is one of those organizations that we just put us in front. So we have one of the seminars that we are like ask away, basically. So ask about women in Islam, or what we believe, and this and that. So that's basically in a nutshell. And there's a lot of food involved.
Fantastic. Please do put your email so that if anybody would like to, in fact, I encourage, if there's a phone number to access services through your organization, where somebody can actually come to your clinics, do put that information in the chat. And I think the bottom line here is really education and cross-cultural understanding. And then I love this whole idea about spending time and active listening as well. So one question in the chat, Pascal says, this is very informative, but it seems so far remote to what's really happening in the health field. Is there anything being done to train or hold physicians to a standard to make building trust with their patient a requirement?
I started answering that question to Pascal, and I'll further that response by saying this. I went to medical school in the early 90s, and my younger brother, who's now a surgeon in New York, went to medical school a decade and a half later. He's 13 years younger than me. And that medical school experience with him was very different. The way he learned, the thing they stressed. I am now a part of a number of medical schools, and the training that I provide to these students is very different. So the new crop of doctors coming out over the last decade and going forward, one thing that you will see is more culturally competent. They are, or even better stated, they have much more cultural humility, which means that they understand the differences that we face every day. But at the very heart of it, how do I actually approach this person with the requisite respect that they deserve? How do we approach this person to do that? So that's being taught in medical school today at a very high level. Almost 3 decades ago when I was in medical school, that really was not taught in the same way. That was picked up during training, a little bit here, a little bit there. So Pascal, great question, but I think it's a very concerted effort today, much more so than it was before, and that's very important.
Indeed. What are your thoughts on that, Husna?
Oh, sorry, I was muted. So I agree with both of them, so the new era physicians are a little bit more like trained and, because in past few years, like, we started to talk about all these, like, topics a little bit more compared to, like, in the past, so now we all talk about, equality or cultural sensitivity and all those things, and building trust. All these things were like, underrated in the past, and now like everybody start to talk about, not only here in the United States, globally, those changes are like, coming up. So of course, any change doesn't happen overnight, and building trust. And like I mentioned early, it could be different for you. The reason for, not trusting the provider or organization, doesn't have to be, my reason to trust, so, we are such a diverse community. So, there's hope that, it's happening. But, like, we still have to do more studies about it and to include, specific communities, specific reasons and all. And it's hard to put it all under one umbrella. But are we training the new physicians, nurse practitioners, PAs and all? Yes, we are talking more about it. But, hopefully in very near future, I mean, when we talk about any equity in any field, of course, talking is more easier than, bringing it all in, like, action. But everybody,
Talk is cheap, as they say. Yes,
yeah.
we've got to
So
take action.
yeah, that's the reality of it, So it takes, like a joint effort, not only from the provider side, and I think as the community, we have to do, like, more towards it. But, I am very happy about the new changes that, for as a provider, we are talking more about it. That's like a good sign. And moreover, I feel very happy when I see this question, how the community is, aware of their own rights, and they're questioning, like, what are you doing, to build trust, So when it comes from the community, of course, and because they are the goal of all this thing is to, to make a better outcome for the people who we serve, so once they're aware of their own rights, which actually makes the change a little bit easier for everybody, organizations, providers, because that's like a first step. I'm happy about, like, everybody's like becoming more aware.
I think, you guys have really said some really concrete stuff, and I want to just kind of summarize a little bit of what I'm hearing. So, I'm hearing, Dr. Pyke, you talked about this whole challenge of having enough time from the physician's perspective. And I want to thank you for that, because quite frankly, I knew about the amount of time that it was required to do the documentation, but I never imagined that doctors were taking the work home with them and doing the documentation there. So thank you for that. And for humanizing and giving us that side of the coin, of the medical mistrust coin. And then I hear us talk about really creating space where we're meeting people where they are in terms of their language, in terms of their insurance status, in terms of their religion, and creating a safe space for people to feel comfortable to come in and to have conversations. So I want to really thank you guys for shedding the light on this really, really complex issue. I think the thing that's really coming up for me now is we've spoken about the things that health systems can do to add the things that health systems can do to kind of promote more of a culture of trust. But what are maybe one or two things from your perspective that patients can do to facilitate or even, dare say, demand the kind of quality service that they deserve? And if each of you would just would answer that question from your lens.
So I'll tell you this. One of the and I wrote an article in the Miami Times speaking about this, and so I forget when it was done, but it's there. It's one of the biggest things that patients can do whenever they interact with any kind of healthcare is educating themselves about themselves and their family. Now, not all of us have that luxury, and therefore I won't be actually thinking that some patients, whether they're for whatever reason grew up in a community where they didn't have the parents there, whatever their situation was, they don't have access to that, adopted, whatever. But you have to also then educate yourself about you and understand yourself. Prepare for any kind of visit when you're coming in to see a physician, and especially when you're coming in to see a primary care physician. Share openly with your provider. Now, that is easier said than done. I will tell you this much about the current structure of healthcare that should give patients some comfort when sharing openly with their healthcare providers. Today, very differently, healthcare providers are held to a standard that is built into the regulation that governs us. And so a lot of things that you hear about things called HIPAA and those things that are all these acts that have been put in by different agencies are put in to protect the patients themselves. We as healthcare providers, we become patients at times, and we need those protections likewise, right? So this is a very important thing that is very different from a decade ago, 2 decades ago, and definitely different from 3 decades ago. There are very strong regulatory requirements for providers today to protect that health information and to actually do certain things that is really important. The other thing you should know about healthcare today as you approach it is that we now look at the healthcare differently from even a payer lens. So even the payers, as they're actually ensuring these populations, they are held accountable for certain things. So a lot of the things that you are actually, when you engage with healthcare, there's protection built in by so many layers that you are dealing with a different entity than your parents did. And so that should actually encourage you to be thoughtful, be informed, and engage very, very truthfully with your healthcare provider. The last thing you want to do is go to a healthcare appointment and not be forthcoming about what's going on with you. That's easier said than done. And it takes time. And it takes longer for certain people, because if you've been hurt in the past, then that's
Sure.
different. So that's really key.
Wonderful. Thank you for that. Husna?
So end of the day, what I want everybody to understand that the reason that everybody make this appointment and going to the doctor, the goal from the provider side and the person side is actually to improve the quality of your health, so that's your right. So be open about what exactly you need, and don't be afraid to ask questions, whenever there's no clarification. So don't be afraid of that, and it is your right. And so end of the day, like I said, it's for your own the goal is like a positive outcome for your mental health, physical health, and overall the health of the community. So just be open about what you need. Culturally speaking, a lot of cultures are not really comfortable. You know, a lot of like I'm from India, like, you know, I know like how Indians a lot of time they don't question the judgment by the doctor and things like that. Whatever the doctor say, even if they don't understand, they're like they don't want to say, like, you know, like they don't want to just tell the doctor that I did not understand what you were saying, or like, you know, maybe I have a question about your decision, but I don't want to just say anything because I want to show my respect, or, you know, I just want to,
Yeah.
you know, show that part. And which is common in a lot of, like, you know, they don't want to be like, you know, feel like, you know, or maybe like, you know, they're going to be looked down and things like that. There's no such thing. And, you know, all the providers are trained to address all these issues. So be comfortable with the questions. You know, we are in a world of, like, you know, now we can address like everything. And here, like, you know, I'm sure that we all came from different part of the world, but here, like, compared to other parts of the world, you know, we can express our feeling better compared to many of those, you know, areas. So just be open about it and know your rights, and be prepared in advance, you know, when you go for the visits, or like take a note, you know, like what you want to ask about, so you don't forget, so you don't have to worry about this time frame and all. And
Mm,
this is why I even go to, like, you know, I go to my provider, like, you know, with a list of things, 1, 2, 3, 4, 5, like that. You know, I just go
with
through a
good
list of, make sure,
suggestion.
like, you know, I do that even as a provider for this many years. You know, I still do it the old-fashioned way. Don't be ashamed of like doing any of those things. Whatever make you comfortable, what, you know. So just be open for that.
Thank you. I like that idea to go with your list of questions ready to get them addressed. All right, Tehsin, what are your thoughts?
Well, all of what I wanted to say has been said. I'm going to echo the sentiment what Dr. P said. Educate yourself, but don't educate too much about it, of a
Don't
disease.
rely on Dr. Google, as they
Yeah,
say.
Dr. Google. I think having a healthy amount of information is very important, so that it just your encounter with a provider just goes so much smoother. I usually don't have that much problem when the patient says I have A, B, C, and do D, E, F for me. But lot of healthcare providers do have that issue, because then they say, listen, you know what's wrong with you, so might as well just do what you need to do, you know. So give that, when we talk about active listening from the provider, there has to be an active listening reciprocated as well. So listen to your provider. We did not go into healthcare field to make you miserable, or like not care for you. Majority of us in medical care, all of us, and majority of us in healthcare field, we take the reason we went in this is to provide services where it was most needed, to help the humanity. That's the bigger goal. People think it's to make money. If I needed to make money, I would be a businessman. I would do a master's in business and go that route. No offense to anyone who has an MBA. I know Dr. P does too. But that's the reason we're in there. Your health is important to us, and also have realistic expectations. If you didn't see a provider for 20 years and you start for when I used to be 5 and this happened to me, and you are 75 years old, it takes time. You are going to need a follow-up, because that's how the system is, and believe in the system. System is in place for a reason. So that's why you go for follow-up appointments, and don't miss your follow-up appointments. It's important for you. That's basically, and I would say that all of this comes with the trust, but you gotta have to give a little bit trust to get some too. So
that's a really good point. And mentioning system, it triggered a question for me, which is the one part we have not talked about with the conversation. And I know we're at time now. So Dr. P, I'm going to ask you this question, and if you could answer it succinctly, if you can. I think a large part of this medical mistrust really is the healthcare system as a whole. There are a lot of systematic barriers that create this culture of mistrust. We talked about one today, which is this whole time constraint and the documenting piece of it. What are you doing at Jackson Hospital as an healthcare administrator to help remove some of the barriers that keep us mistrusting the healthcare system and keep health disparities as a reality?
So we're doing a lot that's probably not going to happen in 30 seconds, me explaining, but we actually have an entire department that deals with population health. And what that talks about is we recognize the social determinants, and we recognize that as being such an important aspect of delivering very, very much world-class healthcare. And so with that aside, whether it be food insecurity or other insecurities that patients have or people have when they interact with our system, we want to make sure we address that. Let me tell you one more quick thing, though. We are also held accountable because, places like the Joint Commission as a regulatory body that governs a lot of things, they hold us to account for these things. We have to do it today. So a person who's engaging in the healthcare today should be comfortable in knowing this, that there are regulatory bodies that forces us to do this. We get penalized now when a patient gets readmitted because we didn't take care of them properly the first time. We are paid in large scale by what's called like a value-based purchasing kind of thing. And while that's a big wording, it means that we have to do better. Otherwise, we won't get paid as much. And that kind of healthcare interaction on the payer side is helping patients every day because it's holding us, the health system, to account even greater than we did 10 and 20 years ago. So patients should be more comfortable knowing that there is a big brother that they don't know about that's actually watching over them, making sure we do the right thing. Even for those of us, I know that Tehsin is more optimistic than I. There are some bad actors in healthcare that have done bad things. Most of us do the right thing. Most of us want to do the right thing. But those regulatory bodies are there to force all of us to pay attention. And that's really key.
Fantastic. One final word of wisdom, each of you, that you can share about moving us towards a culture of trust in healthcare. Go ahead. Go ahead, Dr. Pyke.
My word
Since
to you.
You're unmuted, and everybody else, you can unmute yourself, and then let's do it really quick. Go ahead,
Sure.
sir.
So I think the word of wisdom is to actually educate yourself about you. Each individual, especially an adult individual, you have to actually present yourself, knowing that, number one, you are the leading person in your life, and you owe it to yourself to actually be prepared when you engage with healthcare. It's your life, to Husna's point. It's your life. You have to actually be empowered. Don't wait for someone else to empower you. Now, for the most part, I have two girls likewise. Their mother is their primary care person, even though she's not a physician. She's a doctor, but not a physician. And so women lead most household decisions. You have a lot of things on your plate. Don't take it lightly. When you engage, ask questions. Don't be afraid to ask questions about your kids, how to make them healthier, what kind of practices. Engage purposefully and prepare before you go to every appointment. And to Husna's point again that she made, write them down, because when you get there, everyone gets a little white coat syndrome. They forget what they wanted to ask. Write it down so you make sure you would get your questions answered. That's what I would have to say.
All right, fantastic. 30 seconds, ladies. Anything else to add?
I'll echo the same sentiment.
Yeah, I actually agree with them because we make as adults, we know that we have to provide for the and we family. We know how to send kids to school, and we take care of all of these things, right? So the same way I believe that you have, like, everybody, including ourselves, we have the same duty towards our health too, and nobody's going to walk in our shoe for us, so we have to take responsibility of our own health too, and we are all there to help you. But at the end of the day, including myself, like, we are responsible for our own health in some way. We are all there to help you. So, just be aware that, just like you go to work and, you go to gym and you send your kids to school and all, please find that time to visit your doctor too, at least like, once a year, even if you're healthy.
Oh, I love that. Nobody's going to walk in your shoes for you. I love that. Thank you so much for spending this time with us. You gave us quite a few nuggets. And I want to say thank you also for being so passionate and committed to serving the community. Thank you guys for joining us for this conversation on medical mistrust. As always, you can visit livehealthymiamigardens.com, which is a trusted source of local health resources in the city of Miami Gardens. Thanks for joining us. Be well, everybody.
Bye. Take care.
Thank you.